All right, so I'm going to be talking about preventative care today. That is the big issue, in my opinion, with healthcare is the lack of preventative care. All right, and so first question is, what is preventative care? As you can see from the screen, regular doctor visits, screenings, pediatric, especially at the pediatric level. But the big thing I'm going to tackle is the education or lack thereof education and the funding for preventative care. So reasons we want prevention as opposed to treatment is because of health costs. It's a lot cheaper to prevent a disease. It's a lot cheaper to prevent an injury than it is to treat the injury or treat the disease. Now, that's not something the healthcare industry would like. I think the healthcare industry wants sick people. That's how they make money. So that's why I believe that that's why I believe that prevention is not really taught that well. And we've talked about this before, that the healthcare workforce is not there. It's not there for the amount of people that are sick. It's not there for the amount of people that have diseases. It's just not there. We could do everything we can to create more doctors, create more nurses. That doesn't mean the quality is going to go up. That doesn't mean the cost is going to go down. And that doesn't mean the access is going to go up. We talked about that last week, how access, quality, and cost are all connected. And you really can't have two of them without the third one being effective. Or without the third one being affected. The CDC put out this, when I was looking around the CDC's website, they had that every 7 out of 10 American deaths are related to a chronic disease, something that is prevented, something that could have been prevented. All right, so I have this sheet up. So what are the chronic diseases or chronic conditions? Heart disease and stroke, cancers, such as lung cancer due to tobacco, diabetes, arthritis, obesity, respiratory diseases, oral conditions. And it shows what are the causes: lack of physical activity, poor nutrition, tobacco use, excessive alcohol consumption. All right. And it shows right here costs for this in that given year. For cardiovascular disease and stroke, 313.8 billion. Ton of money. So the health costs and the healthcare workforce are the reasons why we want to teach about prevention. All right, and this is really what needs to be done. The funding needs to go up tremendously for health or for preventative care. All right, the CDC had a statement on their website there, and it said if the local, the state, the federal government just put $10 per person per year in a community-based program that tackled physical inactivity, poor nutrition, smoking, it would save more than $16 billion in medical costs per year. So if they put $10 per person into community-based programs that tackled those problem areas, physical inactivity, poor nutrition, smoking, it would save $16 billion in medical costs or visits. So I think that would be very cost effective if we funded community-based centers like that or community-based programs like that. Finally, the education. The education is behind completely. I teach middle school health at the 8th grade level in New York State. New York State is supposed to be one of the best educational public schools in the United States, if not the world. We, in the middle school, for 8th grade, I teach, they get health for 90 days out of 180-day calendar year or 180-day school calendar year. In 6th grade, they get 45 days. So between 6th and 8th grade, they are taught a total of 135 days of health. 135 days of health in 3 years. Between 6th and 12th grade, in 9th grade, they have 1 or half year of health, which is 90 days as well. So they're taught 135 days in middle school. Then they're taught 90 in high school for a total of 225 total days from when they're in 6th grade to 12th grade. So they are taught health for 225 days out of 7 years. And we wonder why we have these overweight, obese, chronic disease problems in the United States. So basically what needs to be done? Fund health centers more, fund health education, and we need to teach health education almost like we teach math, ELA, and social studies. We need to teach it every single day.